Hi, Kamarul. Hi, Revati. So today we are going to start with
Hi,
validation.
sir.
Validation therapy is a dependent therapy. Validation therapy is a dependent therapy. And what we have seen, DBT, dialectical behavior therapy, that is an independent therapy. There are certain therapy which you can do it alone. That is only by using DBT you can give a counsel. But there are certain therapies are called dependent therapies. The dependent therapies are those therapies which you cannot do it alone. You should always use the independent therapy along with it so that it will give some kind of, so that you will be able to interpret it. Validation therapy is a dependent therapy, and particularly validation therapy, it is used with the dementia patients. So, can anyone tell what is a dementia? What is a dementia?
It's a short-term memory loss.
Okay, anything else? Dementia? Anything else? What is a dementia? Particularly in dementia, we are using two aspects. One is validation therapy, the another one is reminiscence therapy. Two therapy we will be using. Okay. Yeah, Suganya. Okay. So before going to therapy, we will see some aspects about the dementia. Okay. So dementia. Dementia is not a specific disease, but is rather a general term for the impaired ability to remember, think, or make decisions that interferes with the doing everyday activities. Alzheimer's disease is the most common type of dementia. So, one of the aspect which comes under dementia is Alzheimer's. Though dementia mostly affects older adults, it is not a part of normal aging. So, dementia is not part of a normal age. So, it is not a specific disease also. It's a general term for the impaired ability to remember. So, what is dementia? Dementia describes a collection of symptoms. That is not one symptom, a collection of symptoms caused by disorders affecting the brain. It is not one specific disease. So, it is a collection of symptoms. Dementia can affect thinking, memory, and behavior. Brain function is affected enough to interfere with someone's normal social or working life. For example, when my mother was uh, in her last days, she started forgetting things. She was 74 years old. So what she will do is, I will give her tiffin, breakfast. She will eat the breakfast. Then I will take the plate and wash her hands. I will give. I will once again. Please mute your calls. Once again. Okay. So, so what she used to do is, after some time, she will be crying. I will go and ask, why are you crying? She will tell, see, morning onwards, you didn't give me breakfast. And see, nobody's there to take care of me. Now, I know that she has taken the breakfast just now, but she will forget. So it is not what you call intentional. It is the brain will forget the things which has happened in the short term and also sometimes long term. She forgot my name at some point of time. டேய் நீ வந்து உன்னை நீ வந்துட்டு என்ன உன் பேரு like that. She forgot my name also at some point of time. No two people experience a dementia in the same way. So it will differ. It is essential to get a medical diagnosis when symptoms first appear. So when people get old, when people start forgetting, immediately a medical diagnosis is advised, and also the brain stimulating exercises that we can give it to the people. People often lead active and fulfilling lives for many years after their diagnosis. It will not interfere more, but it will have effect on their day-to-day activities. Because dementia is a general term, its symptoms can vary from person to person. People with the dementia have problems with memory. They have a problem with attention, communication, reasoning, judgment, and problem solving. Visual perception beyond a typical age-related changes in vision. So visual perception also may change. Signs and symptoms of dementia. Early signs of dementia can be subtle and may not be immediately obvious. So only when my mother started asking these questions, we were able to understand, okay, she is forgetting things. Till that time, the things that she might have been forgetting that would have started happening, but we do not know. We do not know. And it comes to notice only when she start telling about it. When she starts sharing about it. So the common symptoms, these are the common symptoms. Can anyone read it? Read this? Can anyone read this?
Memory loss, common symptoms, memory loss, changes in planning and problem-solving abilities, difficulty completing everyday tasks, confusion about time or place, trouble understanding what we see, objects, people, and distance, depth and space in our surroundings, difficulty with speech, writing, or comprehension, misplacing things and losing the ability to retrace steps, decreased or poor judgment, withdrawal from work or social activities, changes in mood and personality.
So the things which already I told. Actually, I was able to see most of the aspects. Actually, my mother is very good in Malayalam. Actually, we are in Tamil Nadu, but my mother studied in Kerala. So she used to write in Malayalam. She used to speak Malayalam very well. But in her later years, she lost touch with it, and she was not able to write, because she used to write in Malayalam. She was not able to write. So so even if people are coming in the long distance now, maybe they will not be able to identify who is coming, because they will not be able to recollect the name. A decreased or poor judgment, withdrawal from work or social activities. So this will happen to people slowly. Actually, my mother started using sitting on the cot always, but we used to take her outside. Changes in mood and personality, because they forget, they will think that people are not taking care. So their mood and personality will change. Yeah.
Signs that may point to dementia include getting lost in a familiar neighborhood, using unusual words to refer to familiar objects, forgetting the names of a close family members or friend, forgetting old memories, not being able to complete tasks independently.
So most of the aspects for people with 60 plus now, these are the aspects may happen. So people will go to a restroom but they will not take bath, they will come out. Then they will tell, why I went inside for taking bath, but I didn't take. They might have taken bath, but they may forget also. So they will not be able to complete the task, and also they may forget aspect. They may getting lost in familiar neighborhood in their own house. If there are three more, 6, 7 rooms now, going into the correct room also will be a problem for them. They may not be able to go. So these are the various aspects people will have. Yeah, please read it. Yeah, Karishma.
Poor or decreased judgment, frequent memory loss that affects daily activities, problem with abstract thinking, WH, problem with language, example forgetting simple words, loss of initiative, misplacing things or putting them in inappropriate places, difficulty performing familiar tasks. So can you scroll your screen?
Yeah, changes in personality, disorientation with the time and place, changes in mood or behavior. Okay, who gets dementia? Yeah, the people, anybody may get with age. So it depends upon age, genes, health, and lifestyle. Over the age of what do you call 65, dementia affects almost 1% in 10. Above 85, dementia affects 3 people in 10. People under the age of 65 can develop dementia, younger onset dementia, but it is less common. Dementia can sometimes be hereditary, but this is quite rare. Dementia is not a normal part of aging. So in normal part of aging also people will forget, but here that will be more severe. So the risk, one is age, family history, race and ethnicity, poor heart health, and a traumatic brain injury. These are the risk factors for dementia. So diagnosing, how to diagnose? What causes dementia? Many different conditions can cause a dementia. In most cases, dementia, why people get it is unknown. The common types of dementia are Alzheimer's, vascular dementia, Lewy body disease, front temporal dementia. So Alzheimer's disease, that is what we might have heard, all of us we might have heard. So this is one of the common cause of dementia. So maybe 60 to 80 to 90% people, they get this Alzheimer's. Out of the people who get dementia, 80% will be Alzheimer's. Alzheimer's will be high. It is caused by specific changes in the brain structure. So one of the aspects which will be very, very useful is during that is neuroplasticity, certain brain exercises that will really help the people with Alzheimer's. Then vascular dementia, about 10% of dementia cases are linked to strokes or other issues. It is because of the blood flow which is going into the brain. Diabetes and high blood pressure, high cholesterol are risk factors. And it is also only 10% people are affected. So mixed dementia, it is more than one type of dementia is present. For example, for some people, Alzheimer's also may be there and vascular dementia also may be there. The vascular dementia, it may be because of high BP and cholesterol. And reversible causes, one is vitamin tablets, vitamin deficiency, thyroid hormone imbalance, and side effects of medication. So these are the aspects the doctor will be taking care. So treatment, it depends upon the client. For Alzheimer's, there is no cure. There may be some medications, but everything it doesn't cure. It is you can only stop it at some level. But there are therapies which can really help the people with the dementia. healthy lifestyle, and doing regular exercise, brain exercise, maintaining social contacts. These all are the things will reduce what you call uh, the various aspects of dementia. Now, today we are going to see about validation therapy. In validation therapy, actually, what is being done is it just validates the concern of the client. In validation therapy, we don't try to trigger memory and all. So we go with the flow of the client. We validate their feelings. We don't reject it. Suppose somebody says, I see you didn't give a breakfast for somebody. Said, okay, just wait, I'm giving you. So it is a validating their approach, validating the aspects. So validation therapy, it deals with person's feelings. It is not intended to improve a person's cognitions or to delay cognitive decline. Reminiscence therapy, it is intended to improve person's cognition and the cognitive decline. Whereas validation therapy, it is to deal with the person's feelings. It is intended to draw people out, encourage communication, and validate the client's personal truth. For the client, breakfast is not given. That is a personal truth for them. Validating it. When used consistently, validating therapy can reduce the number of intensity of challenging behaviors, decrease the use of drugs used in treatment, and provide some kind of comfort with the dementia. So how that it is being done, we will see. So we will go into the validation therapy. Now I will show you a video. Just to put MP in the chat box. Please put MP in the chat box. Please put MP in the chat box. That's great. Okay. Okay. Now, I will play a video. This video, it will definitely disturb you. I'm telling you in advance. It will disturb you means it will disturb you positively, not on a negatively. Actually, not only in dementia, what is that you are going to see? You can practice in all the counseling. In all the counseling, you can practice it. So we will see the video. Then we will start discussing about the various aspects of validation. So Naomi Feil, F-E-I-L. She only developed this particular therapy, and you can see her treating a client with a dementia, old age. Gladys Wilson, her name. She is not able to talk. She is not even able to open her eyes. And how that she is doing it spontaneously. That is what we are going to see.
When people are very old and deteriorated and no one enters their world and they're just sitting there, they will withdraw inward more and more,
And their desperate need for connection is all now inside. And if a person is all alone, even if they're very, very deteriorated, there's a longing for this kind of closeness. Mrs. Wilson, hello. You want me to sit? Can you see me good? Gladys Wilson is a wonderful example of a person who is in the phase of repetitive motion, where people use movements, repetitive movements, because they don't have any more speech or very little speech, but they have human needs that need to be expressed. You're crying. You're crying. You have a tear right here in your face. You have a little pain. You don't want me to touch you. You're very sad. Can you see me? Is it scary? Are you afraid? And if this person sits with their eyes closed, rocking back and forth, and maybe there's a tear coming down, there's a need there. There's a little tear that's coming out. Do you feel it? You feel a little tear? If you gently use touch, and I touched Gladys Wilson for the fingertips right here on the cheek, is where the mother usually touches a child. If you touch an infant there, it looks up, and every cell remembers where it was touched by the mother. And often that person knows, even if they can't say a word at that moment, they won't talk, or they don't want to talk, but there's a communication. And that person is no longer alone. Can you let me in a little bit? You think? Just a little? You think I could be with you and Jesus for a minute? Jesus loves me, this I know, for the Bible tells me so. I used music, because when speech is gone, music, especially with Gladys Wilson, it was religious music, because there's emotion tied to it and safety tied to it. So I used her old church songs. Jesus loves me, yes, Jesus loves me. Yes, Jesus loves me, the Bible tells me so. What I did was, when she moved, I moved with her. And when I was singing, because she didn't sing with me, so I matched the intensity of my voice to the intensity of her movement. And pretty soon, for a split second, we became one person. Jesus loves me. Yes, Jesus loves me. The Bible tells me so. So at one point, when she got very quiet and very peaceful, and my voice became very quiet as hers and very peaceful, and my breathing slowed to her breathing, she pulled me to her, and I moved with her. And for her, at that moment, I believe I was a symbol of her mom. Can you open your eyes now? Do you see me? Feel safe and warm? Yes? Can you sing with me? He's got the whole world in his hands. 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 He's got the mothers and the fathers. He's got the mothers and the fathers in his hand. He's got the mothers and the fathers in his hand. He's got the whole world in his hand. The breakthrough doesn't happen every time. The person will not always open their eyes and look at you. But if you keep trying, And you keep centering yourself and really look at that person and really mirror their movements. Maybe not this time, but the next time you come, you'll have a communication. You feel safe. You feel safe? Yeah. With Jesus? Yeah. And me?
So I told you it will really disturb you. So how many of you felt disturbed?
Positively, yes.
Positively.
Yeah.
So actually, whatever we are talking, actually our Fatma ma'am has undergone really. Okay, I don't want to trigger her, but she has taken care of her dad like anything. I tell you, she is one of the wonderful child. She is actually great. Now she is crying. Maybe that is catharsis. But I know the way in which she has taken care of her father. Uh, Most of the people don't do it. Yeah. So can you people tell me what are the things which you observed in the video? Yes, Tim?
The emotional connection
Mm. Okay.
and how the way she helped her client to involve in her song and made her to do such movements with her.
Okay. So how that process? Okay. How that process happened? How that she started talking? Do you find any the way in which she was talking was continuously same, or it changed? And what is that she tells about it?
She matched the pace of her voice with her.
Okay.
If she starts tapping fastly, she started singing fastly. If she slows down, she started singing gently.
Yes. So the voice was going lower and lower, but she was also moving towards the client more, isn't it? She was going towards the client more, and she was really, that was she was told one thing, that was what matters. She was really wanted to connect. She really wanted the client to uh, feel the change. So at the end, the client started talking actually. The client started making lip movements, isn't it? So a few of the aspects she did. Actually, that is called modeling in NLP. Modeling. In neuro-linguistic programming, we call it as modeling. That is, when she sings, the tapping, according to the pitch of her, she made it. So she tells here, she tells in this place,
No longer alone. Can you let me in a little bit? You think I could be with Jesus loves for the... I used music because especially with Gladys Wilson, it was tied to it. So I used her old church song. Yes, yes, Jesus loves me. The Bible tells me so. What I did was, when she moved, I moved with her. And when I was singing, because she didn't sing with me, so I matched the intensity of my voice
I matched my intensity of the voice
to the intensity of her movement.
Of the intensity of her movement. So that is what very important.
And pretty soon, for a split second, we became one person. Jesus loves me. Yes, Jesus loves me. The Bible tells me so.
No,
So at
she
one
read-
point, when she got very quiet and very peaceful, and my voice became very quiet as hers and very peaceful, and my breathing slowed to her breathing, she pulled me to her, and I moved with her. And for her, at that moment, I believe I was a symbol of her mom. Can you open your eyes now?
So you can see she is moving herself along with the client. In my opinion, in my personal opinion, this is what actually a real, what do you call a counselor? A real thankful counselor. That is, we are able to see the output in front of our eyes. In front of our eyes, the output is shown. So this is just validating the client, validating the client, validating the client feelings, validating the client behavior. That was very nice. Srinivas, I have observed. She wiped out tears gently, like a mother. Is not acting. Therapist validates her feeling. And she asked her to touch a part. What is that part? What is the part she asked to touch? Which part she touches? Which part she...
Near, near her eyes. Actually, she was rubbing through here.
Yeah.
So, yeah.
This
On the
place.
side, yeah.
And even in emotional freedom technique, EFT, this plays, it has a very vital role. It plays a very vital role, wherein it has the ability to trigger the feeling. So one is modeling, which is being used in this particular video, and also the validation and the other aspects. So as far as the facial language, the facial language is concerned, what is that you were able to observe? As far as the facial aspect is concerned.
The tears,
Here, yeah, then
And the therapist
she was opening her eyes. Sorry.
smiling.
yes. So I'm talking from the perspective of the therapist. Therapist facial reactions.
She carried a smile throughout her session.
That was wonderful observation, Karishma. Whether the client is seeing me or not, because the client has closed her eyes. Okay, I do not know whether she is seeing me or not. So I don't assume that I can keep my face like anything. I smile whether the client is seeing me or not. I smile. So we will see a few more aspects of validation therapy. Yeah, can anyone just read?
Validation therapy is a way to approach interactions with a person who has dementia. Validation, as a general term, can be defined as the acceptance of the reality and personal truth of another's experience. This, in itself, is a central element of all humanistically oriented therapies and a key aspect of person-centered approaches to dementia care.
So the personal truth of another's experience. So I have some experience. That is my personal truth of experience. That has to be validated. That you should never reject it. So not only in validation therapy, even in dialectical behavior therapy, the process starts with validation. Isn't it? Can you people just recollect? Yes, team? Recollect DBT. DBT, do we have validation? Nobody's there?
Sir, we are here only, sir.
Validation. We have seen DBT. In DBT, what is one of the process?
Validation.
Yes, validation.
Validating the emotion.
Validating the client. That is, neither we are accepting nor we are rejecting. That is validation. We are not rejecting it, and we are not also accepting it. Just we are validating it. So that validation is part of many therapies of humanistically based therapies, oriented therapies. So even DBT is one such, and also what you call motivational interviewing. That also, it also talks about validation. Yeah. Yes, please read.
Person-centered approach. All people are unique and must be treated as individuals. All people are valuable no matter how disoriented they are. There is reason behind their behavior of disorientated older people. Behavior in old age is not merely a function of anatomical changes in the brain, but reflects a combination of physical, social, and psychological changes that take place over the lifespan.
So it is not just physical and the brain structure changes. It is much more than that. Yeah.
Old people cannot be forced to change their behaviors. Behaviors can be changed only if the person wants to change them.
For
Old
example,
people,
there will be certain behaviors which may irritate the people. They will go to restroom, then within 5 minutes again they will go. That we cannot change it because it happens because of their what do you call brain aspect. So slowly we have to orient them. Yeah.
old people must be accepted non-judgmentally. Particular life tasks are associated with each stage of life. Failure to complete a task at the appropriate stage of life may lead to psychological problems.
So there are certain aspects in every stage we have to do. So 60, 70 and all, we should be able to remember names. If you are not able to remember, that is that may lead to psychological issues, and also if it may be due to physiological problem, but that will lead to psychological issues also. Yes.
When more recent memory fails, older adults try to restore balance to their life by retrieving earlier memories. When eyesight fails, they use their mind's eyes to see. When hearing goes, they listen to sounds from the past. Painful feelings that are expressed, acknowledged, and validated by a trusted listener will diminish. Painful feelings that are ignored or suppressed will gain strength. Empathy builds trust, reduces anxiety, and restores dignity.
So when the recent memory fails, the people, aged people, if they are not able to talk, if they are not able to see things, they start seeing things visually. If they are not able to hear anything, they will start hearing things which has happened in the past. So what they require is empathy, and we should try to connect with them. that will make them to come to the present, and they will that will help them to understand, help them to deal with the present much more effective. Yeah.
Dementia, umbrella term for loss of memory and other thinking abilities severe enough to interfere with daily life. Alzheimer's,
Yeah, Alzheimer's, 60 to
Alzheimer's,
80%.
Lewy body dementia, 5 to 10%, vascular dementia, 5 to 10%. So it's not visible.
Friend tempered dementia, 5 to 10%. Others and Parkinson's, Huntington, that is there. Mixed dementia, that will also cause dementia, likely dementia. This all these aspects already we have seen. Okay, the causes, everything we have seen. So the 4 stages of behavior associated with dementia is malorientation, time confusion, repetitive motion, and vegetative. These are all the 4 stages. So validation therapy is one of the aspects which validates the emotional aspects, and it has a validated, evidence-based validated therapy which helps in people, and it is developed by Naomi Phil in 1960s and 1970s to give a dignified care for the people who are in the final when they are counting their final days. Validation emphasizes empathy and listening and empathy. Validation therapy is based on the idea that once the person has experienced severe short-term memory loss and can no longer employ intellectual thinking or make sense of the present, so he or she is likely to go back to the past. This may be in order to resolve unfinished conflict which has happened in the past, relive past experiences, or to retreat from the present over which they have little control. Some people will go in and out of the present. They will come and go. They will come and go. These all are the things may happen. So the basic principle behind validation therapy is communicate with respect, showing that their opinions and beliefs are heard, acknowledged, valued, and esteemed. The therapist doesn't dismiss or marginalize the thoughts. So whatever they are telling, we don't try to marginalize it. So these all are the aspects of validation therapy. Validation therapy has at its center 14 techniques. So the 14 techniques I am sharing to you people. Just go through it, and we will. I'm sharing the video also in the group now. Also this PPT on the group. Just go through it. And one of the aspects is this is only for older people. And you may get some people in the old age for counseling and all you may get. We may also become old. So this may be helpful for our own self also at some point of time. Isn't it? We also on every day we may be becoming older, isn't it? So with this, I will finish today. I'm sharing the aspect in the group. Okay.
So,
all right. Yeah, Karishma.
So one last question, when we have clients with dementia, in this they will not be in need of any clinical treatment.
Clinical treatment will process. For example, we have seen that the old woman,
yes, sir.
Perhaps they may be giving tablets. Okay. But the tablets will have a very little effect as far as the memory is concerned.
And so, if we are attending such clients, then we need to have any license
for this dementia and all. Dementia, it doesn't come under rehabilitation.
Okay.
It doesn't come under rehabilitation. It comes under counseling one. Because dementia is not a disease. Dementia is not a disorder. And RCI deals with the things which are disorder in nature. This is not a dementia is not a disorder. It is a disease It is a collection of symptoms.
Okay, sir.
And the thing is, nowadays we cannot believe AI also. Artificial intelligence, whatever artificial intelligence gives, that may not be correct. We are putting about GTCCO, and I think Kamarul only put in ChatGPT, and it has said that GTCCO is registered with the RCA. Then I told my people, artificial intelligence is cheating. GTCCO is not registered with RCA. So we cannot believe artificial intelligence completely. Always human touch is human touch. So thank you very much. Any other questions?
Sir, I have.
Yeah.
Not related to this, sir. You like in last class you told you will be sharing the PPT.
Yeah, I will share.
शायद आप भूल गए.
DBT. No. DBT, I am making some more slides. Okay. So I will upload in the drive and I will give you a complete aspect.
Okay, sir. Okay.
And along with the questionnaire also. You will get a questionnaire also, which I am preparing.
Okay,
I will
sir.
definitely will get. The complete aspect you will get. Yeah, anything else? Okay. Thank you. Bye-bye.
Can you use it for Parkinson's patients?
Yeah, I will see it. I will see it.